we'll be talking about global developmental disorder. If you don't know what that means, it's short for GDD, sometimes refers to as global developmental disorder. It is a neurodevelopmental diagnosis in the Diagnostic and Statistical Manual of Mental Disorders. Pretty much it's in the DSM-5. For an individual to meet the criteria for GDD, they must experience delays in achieving milestones in several areas of intellectual functioning and learning. Provider will re-evaluate someone with a diagnosis of GDD as they get older to obtain a more specific and accurate diagnosis. Characteristics of global developmental disorder. According to DSM-5, I will put a link to that down below, just so you guys are curious. Global developmental delay is, as its name implies, is diagnosed when an individual fails to meet expected developmental milestones in several areas of intellectual functions. Symptoms of GDD can include, but are not limited to, delays in motor skills, including crawling and walking, difficulty with fine motor skills, language and communication delays, difficulty understanding communications, difficulty with problem solving, difficulty with social skills. Identifying and diagnosing global affective disorder. Providers diagnose intellectual disabilities by assessing an individual's cognitive and adaptive functions. Although adaptive functioning may be evaluated before birth, many cognitive tests requires that a child be at least 6 years old for the testing. Some IQ tests can evaluate children younger than 6, but long-term research shows that these scores do not accurately predict future learning prior to age 6. Providers can identify developmental delays in many ways, including diagnostic interviews with the parent or guardian. This interview consists of gathering extensive detailed information about the child's history so far, developmental progress, and any known medical issues or injuries. The Vineland-3 measures adaptive functioning in several domains, including communication, daily life skills, social skills, and motor skills. There is a parent form that can be administered as early as birth. There is a teacher form that can be administered start at age 3. Adaptive Behavior Assessment System -3 are individuals' adaptive skills for birth through their lifespan and assesses from developmental and learning disability, neurosophical disorder, and physical impairments. The Bayley scales measure cognitive, language, motor, social, emotional, and adaptive behaviors growth in preschool age children to determine whether developmental delays are present. Cause of global developmental delay. Because GDD is a general term and not a specific diagnosis, many different things can cause a child to experience a delay with this label. However, genetics can cause developmental delays. Other times, the environment can cause GDD, both before and after the child's birth. GDD can begin before birth when caused by exposure to a drug or other toxic substances, premature birth, prenatal infections, or hemorrhages. Following birth, head traumas or certain infections such as meningitis can cause GDD. Finally, malnutrition, abuse, or physical neglect can cause a child to experience developmental delays. Treatment for global developmental disorder. Sometimes children outgrow developmental delay and catch up to their peers with minimal interventions. Many benefit from treatments and services to help them reach their full potential because GDD is a general term for delay that can manifest in many different ways. Providers determine the most appropriate intervention on a case-by-case basis. Treatments that can help: birth to 3 programs. These programs emphasize helping a child reach missed milestones and catch up to their peers. Early childhood special education. Preschool and kindergarten programs can offer individual special education to help meet a child's special needs when the child exhibits developmental delays. Physical therapy. Physical therapists can help a child by teaching them exercises and skills to catch up on a motor delay or recover from an injury that might cause delay. Speech therapy can help children learn to use language to express their needs, to emphasize articulations, vocabulary, or other forms of communication. Yeah, when I was in school, I was in special ed for that reason on speech therapy. Like, I had a lot of tubes in my ears, so I couldn't really hear the sounds, different sounds that the letters would make. So I was in special ed, or I was in that like most of my school years. OT, occupational therapy. It helps with adaptive skills. OT can help elevate sensory issues, development fine motor skills, or complete other functional tasks. Reevaluations, because GDD is a general term for unspecified developmental delays. As a child gets older and can undergo more specific assessments, reevaluations can help identify and understand their delays and provide a more specific diagnosis. As the child gets older, they will need reassessments to gather more specific information about the delays and more specific information about their diagnosis or diagnose. Support for global developmental disorder. Some children diagnosed with GDD are able to catch up developmentally and will no longer meet the criteria for a developmental disorder as they get older. Others continue to experience mild, moderate, or severe difficulties throughout their lifetime. Parents and caregivers whose child has a diagnosis of GDD can ask their treatment team questions they have about their child's specific delays and what interventions might help them catch up. They may also benefit for support groups where you can connect with other families going through similar situations. Alright guys, I hope this has helped you in any way. If it has, make sure you give it a thumbs up, share with friends, get the message out. And if you guys want to see like anything, like any topics or anything, let me know down below. I love you guys. Stay safe. We'll see you in the next video.